The DHB is forecasting a final deficit of $27 million for the current financial year. That figure has effectively doubled in the last 6 months. The DHB has also forecast that its deficit position will further increase in 2015-16 to between $30 million and $42 million. This accounts for over half of the combined deficit of all 20 district health boards. This is a situation that can no longer continue. Over time, a number of steps have been taken to drive improvement, including the appointment of a Crown Monitor and intensive monitoring by the Ministry of Health. The board and senior management have worked to address financial issues, and nearly all options available to ministers have been tried over the years. The Crown Monitor has advised that the changes required to lift the DHB's performance are significant. Since it became public that I've written to Southern DHB, I note that the Labor Party's health spokesperson has indicated her support for the installation of a commissioner. I welcome that support and note that political opponents are attempting to shift the discussion to the adequacy of the population-based funding formula and a debate on the merits or otherwise of the amalgamation of the Southland and Otago District Health Boards in 2010. In regards to the PBFF, all DHBs are funded according to the same formula and have been since the early 2000s. In a tight fiscal environment, all DHBs are expected to exercise sound stewardship, but no other district health board has failed to control its finances like Southern has. In regards to the amalgamation of the Southland and Otago DHBs, while it was a challenging exercise, the government's expectation is that any issues impacting on financial performance should now be on a clear path to resolution. The government is committed to the redevelopment of Dunedin Hospital and the provision of high-quality health services to all the people of the Southern region. Southern DHB recently published its strategic plan outlining how it will deliver those services. Based on the board's history of failing to deliver on annual plan expectations, I have lost confidence that the current governance arrangements are fit for addressing the challenges that the District Health Board faces. Cathy Grant has been appointed as Commissioner and takes up the role from 9 a.m. tomorrow, the 18th of June. Mrs Grant is a local lawyer and community leader with significant business and governance experience and a proven track record in turning around struggling organisations. After discussions with Mrs Grant, she has indicated that she intends to appoint Graham Crombie and Richard Thompson as deputies. A third deputy with a strong clinical background is expected to be announced later this month. Mr Crombie is a Dunedin local. He has a strong background in accountancy, with a proven record in high-level assessments of the sustainability of health organisations. He also has lengthy governance experience.
Order! Order! Order!
Mr Richard Thompson will also be an important part of the Commissioner's turnaround team. He is a local businessman and has a long-standing commitment to improving Southern health services, and he will be able to provide key insights into Southern DHB. Mr Thompson was Chair of Otago DHB from 2001 to 2009 and has continued as a Southern DHB board member since 2009. He's currently serving his second term on Dunedin City Council. The Commissioner team will bring together a mix of strong financial, governance and clinical skills. The turnaround for Southern District Health Board is not expected to happen quickly. It's going to be hard work. I would like to thank the outgoing board for their work to date. My decision is not intended to devalue their efforts and achievements. However, I believe this decision is the right one to ensure long-term sustainability and the delivery of quality health services for the people of Otago and Southland.
Mr Speaker.
Dr David Clark. Order.
Given years of deficits and months of adverse publicity, perhaps the most surprising thing about the Minister's announcement today is that he is considering replacing the board is that it has taken him so long to reach a decision. I think the politics have dictated the timing. Until now, the government has maintained a facade of arm's-length operation, despite appointing 5 out of 12 board members, including the chair, despite having a Crown Monitor on the board for nearly 6 years. That government watchdog has been reporting to the Minister the whole time and has a direct line to the Minister. Any remaining impression of ministerial distance from decision-making is sacrificed with the appointment of this Commissioner. Perhaps it was becoming a little implausible anyway. I cautiously welcome the appointment of Cathy Grant and Graham Crombie and Richard Thompson, respectively. They are well respected locally, and I hope that they can succeed where the Minister has failed until now. The odds, of course, will be stacked against them. Fixing the DHB will not be easy. The cultural challenges are well canvassed. Some departments have worked well together since the merger, others have not. But of course, one of the big elephants in the room is funding. The Minister can wish that away, but the inquiry that he has launched into the funding model is so narrow, it is clearly there only to dismiss media interest and nothing more. The funding issues will not go away. The Southern DHB trains a health workforce for the rest of the country, and that appears to be inadequately compensated for. It takes longer to treat patients when teaching students at the same time. It has the largest geographic area of any district health board, and yet it doesn't have the largest funding component. It also has older buildings, and that forces older, less efficient styles of operation, which involve more staff time. The Minister must address concerns about the funding model. It was introduced by Labor about 10 years ago, and it is time that it was fully and properly reviewed. The glacial progress towards a hospital rebuild should bother us all. The Minister needs to commit to a full tertiary hospital with level 6 status. So far, he has ducked for cover on that one. And already, the hospital has lost accreditation for the training of intensive care unit specialists. A Becker report late last year said that the Dunedin Hospital's outdated ward and operating theatre layouts were in need of replacement, and that means that a refit will not do it. It's prohibitively expensive to do that. There is asbestos in the buildings and a layout no longer suitable for modern operating, and refitting the old building would not be a wise use of capital. Urgency is needed. The Minister has let timeframes slip. The previous Minister said a business case would be at Cabinet this year. He's said the end of this year. The DHB have said the background work won't even be done by the end of this year now. And there will be no comfort in the South until the Minister commits and has a sod turned before his term of government is out to rebuilding that full tertiary hospital at level 6 standard. People in the South, like people across New Zealand, deserve affordable access to decent health care. It is something every Kiwi should be able to count on. This government has continued to fund health care below the rate of inflation. Our health care services are suffering. This Minister no longer has anywhere to hide. With the appointment of this Commissioner, the fate of the Southern District Health Board is tied tightly to his success in his portfolio.
James Shaw.
Thank you, Mr Speaker. The Green Party is glad that this issue is finally being looked at. The Green Party has raised this issue a number of times, including allegations of fraud in questions to the Minister of Health of the time over the course of the last year. Unfortunately, the Minister refused to engage proactively, which is a shame and which is why we are in this situation today. The government in the past has dropped the ball on the Southern District Health Board, especially when they wrote to the Ministry of Health's Audit and Compliance Unit in December of 2010, seeking an investigation and recommendation, and it took over 3 years for the Minister to respond. It would seem that the problems for this board began when the Otago and Southland DHBs merged 5 years ago. We hope that this is an opportunity to look at the funding model for the region. It is an incredibly large area to serve, and we need to ensure that the people in the area are getting adequate and optimal healthcare. We do have concerns that replacing the whole board with one person is less democratic than the oversight of an elected board. But we do think that it is time that this issue has finally been looked at. This is an opportunity to look at the wider issue, and the most important thing here is that the quality of service for people in the area is not affected.
Barbara Stewart.
Thank you, Mr Speaker. From New Zealand First, we believe that the Health Minister's appointment of a Commissioner to run the Southern District Health Board basically demonstrates a belated ability to manage New Zealand's health services. The Southern DHB has been under government monitoring since 2010 and yet have still been allowed to reach a $27 million deficit this year. And that's set to increase to $42 million in 2016. If Southern District Health Board's financial state is due to board mismanagement, why has Minister Coleman allowed the board to remain in control until now? The reality is that Southern District Health Board has a range of very specific needs. A large geographic region, an ageing population and high rates of bowel cancer that the population-based funding model employed by the Minister does not just cater for. Rather than admit that he has failed to appropriately fund Southern Health Services, Minister Coleman has chosen to blame the board. Southern Health Services have already been cut to the bone by the board. Appointing a commissioner to find more savings will ensure health services across the district are stretched beyond breaking point. We would urge patient care to be the focus of every decision made. When money is the focus, it is too easy for patients and the people who care for them to be sidelined. We see no way that a $27 million deficit that's predicted to increase can be brought under control without affecting the delivery of safe and high-quality public health services and the health of thousands. It is time to clean the slate on this particular issue, and we hope that the Commissioner can succeed and that health services do not deteriorate in the short term.
The Minister in reply. The Honourable Dr Jonathan Coleman.
Mr Speaker, I just want to reassure the people of Otago and Southland that this is about delivering sustainable services over the long term, and the public deserve nothing less. As I've said, the financial situation in Southern just couldn't continue, and that's why today's announcement has been made. It's been carefully considered, and it's the right course of action. On the point of decisiveness, well, it doesn't really come any more decisive than installing a commissioner. And to our political opponents, I'm very grateful that across the House people are supporting this decision, but I would note that if I had removed the board in the first couple of weeks, you would have had something considerable to say about that. There has been a lot of money going to Southern DHB, $135 million extra over the last 7 years, a huge increase in the numbers of doctors and nurses. As to the argument that a deficit indicates underfunding, Labor left a combined DHB deficit of $150 million. We've got that down to $50 million. So by that argument, you'd say that it was actually Labor that was underfunding. But the point is, a deficit actually indicates that the money available is not being allocated correctly. As regards the PBFF, that's been the system that's always been used. What I would say is the government has a very high level of confidence in this team. They're local people, they've got the right set of complementary skills, and I know that the government and the House will wish them well. It's a tough task. They need all the support they can get to get the job done. But there's no question that a new approach to Southern District Health Board's issues is required, and that's what I've announced today.